Boa noite a todas as pessoas aqui presentes. Vocês me escutam?
Good evening to everyone here. Can you hear me well? I'm Pedro de Paula. I am the Executive Director of the Strategy in Brazil, and I have the honor to be your host today. And the MC, how you define it. And in this super important launching that we have Mais Dados, Mais Saúde with the anxiety climate in focus. This event is part of this Urban Circuit 2025 promoted by UN with the Ministry of Cities, and we are very proud to be part of this circuit. And More Data, More Health is a program of innovation in health data collection, and it's an initiative carried out by Vital Strategies and Humane with support of the Devive Institute. This survey starts off the premise that understanding the challenges faced in depth is the first step toward strengthening more equitable and effective public policies for the entire Brazilian population. By generating more data, it's possible to support public management in making decisions that help ensure better health for everyone. We will begin our meeting with an opening panel and then a presentation of the unpublished data of the perceptions and behavior of the population of the Amazonia Legal in face of the climate change, environment, health, and pollution. After the presentation, we will watch an executive preview of the documentary Correnteza on first hand by Ana Peta and Helena Peta about the climate disaster in the Rio Grande do Sul state, and I'm anxious for this moment. We would like to begin welcoming and thanking everyone for their presence here in the auditorium of the Centro Botânico Online, and those who are following us online. We have transmission in Portuguese, in Habitat, and Vital Strategies, both in YouTube. And so to compose the opening, I now invite to the stage CEO of Vital Strategies, Dr. Meni-Ann Etiebet, the General Superintendent of Humane, Thais Junqueira, the Executive Superintendent of the Devive Institute, Renata Bizelli, and the Director of Department of Epidemiological Analysis and Surveillance of Non-Communicable Disease of the Ministry of Health, Dr. Letícia de Oliveira Cardoso. Enjoy your event. I now invite the Director of Executive Superintendent of the Devive Institute, Dr. Letícia Cardoso, for her opening speech. Good afternoon or good evening to everyone here that are present. In the first place, I'd like to thank the invitation for being here in this such important event and promoted by the Vital, and thank you very much for the invitation. This is a huge responsibility to present the government here at this round table, working in the Department of Epidemiological Analysis and Surveillance of Non-Communicable Diseases, and also understanding the climate issues. They are one of the great determinants, and they also suffer the consequence of human action, which are the determinants of the health of the population in different aspects, and also they bring also consequences and differentiated consequences for the populational groups that we have, that in the sense that they have consequences and they sort of affect the most vulnerable people. The country is in a very propitious moment, generally speaking, because we are hosting a COP, which COP30, that will happen in a few weeks, with an important action of the Ministry of Health or the health sector as a whole, taking proposals, effective proposals, of the acknowledgement of the interaction between the climate and health, and not only with respect to what we already know issues from quite a while ago of communicable diseases like dengue and arbovirosis, but also for other fields that we acknowledge as being important to establish this relationship and take care of this relationship within our healthcare system. So the topic about the climate anxiety and the impacts that we know that climate tragedies brings affect the mental health to the population, and they are very acute, and we have to be prepared to embrace and also to take care of the people and avoid these situations. And also issues with respect to the ones related to the planting of tobacco. We have a COP of tobacco which will happen ahead. We have very concrete proposals in the area of the environment, like microplastic transitions of plantation. Brazil is one of the largest, actually is the largest producers. Actually Brazil is one of the largest exporter of tobacco to the world, and it is indeed, as I mentioned, we have several fronts here of action. So we are at very propitious moment, not only with respect to the healthcare, but in different areas of the government, understanding that the energy transition is a very important step so that we can take care of our country and our planet. I thank you very much for the opportunity, and I hope to get to know the data which are important, the ones that will be presented here today, and also discuss this with you. Thank you very much. Thank you very much, Leticia. I believe that those who thank us for the partnership, and I pass the floor to the Executive Superintendent of the Revive Institute, Renata Pizelli. Good afternoon. It is a pleasure to be here with you. Another launching of another action here. We prevent chronic diseases, and we have a lot of care for projects that take this to the SUS and that serves the Brazilian population. I'm very anxious to see the results. Today we had a very good conversation at Vital, and it is interesting how this initiative, like More Data, More Health, then speeds up these actions, how we could bring agility to these processes. So this is the third, if I'm not mistaken, third round, and also it's very impressive to see how we can gather information very fast that are very important for the public policies that are to come. So now the question is, what will we do with these data? I hope you enjoy the results. Thank you very much. Thank you very much, Renata. It is a pleasure to be with you here and to advance with respect to the understanding of the data to improve the conditions we have in the country. I pass the floor now to the General Superintendent of Humani and Thais Junqueira. Good afternoon to everyone. Thank you very much for your presence. I compliment the Ministry of Health on behalf of Leticia and also for this initiative. And Marianne, is it the first time in Brazil?
Cumprimento nossa parceira Renata Bizelli.
And also I compliment our partner Renata Bizelli has supported us since the beginning. The idea of conducting this work between Humane and Vital is to find a way how we can contribute to the very important well-established national service, in a way that we could respond in a very speedy and dynamic way, topics and emerging or hot topics with respect to the public health that have to be tested or generating one or other result in terms of methodology, collection, the time of the processing of these results. And this is what the civil society and philanthropy can do very well. They can organize themselves and get interesting partners and so that they can generate material to feed the future surveys and also the one to be incorporated in other aspects, but can also do innovation with respect to healthcare public policies. The idea, this is a third edition within Mais, Dados, Mais, Saúde, is that we were a partner before in 2 editions of Convitel. We had an interesting, very good learning of this process, and all this work here that is in the web, which is in its 3rd edition, basically it follows the same rationale to work in an agile and dynamic topics with respect to healthcare aspects. Everybody knows that today climate changes has impacted all the lives of all the aspects of our life. In health is even more, actually in all the life cycle, even before we are born, this impact already happens. And this part with respect to Amazonia Legal brought other challenges. And what is very important as well that we'll have the opportunity to hear here today is how did we get to a population that lives in very remote areas of our countries? This was a new learning within this partnership. And another thing that was very important so that we could see and analyze and understand is the difference that exists with respect to the results and the impact among the traditional and non-traditional population. So this regional analysis allowed also a look on this. It brings data that are new, and we build with other organizations, the public and power, and all of us that we have come together to support this initiative. We can use it in different ways, but it can be also unfolded, and there are many things to be understood as well. So we are facing a huge challenge, and we hope that today's work will contribute to everyone, and also may we communicate it or convey it to the best way possible for the Brazilian society. Thank you very much. Now, thank you, Thais. It is a pleasure to continue in this undertaking where we can test and advance in the generation with respect to healthcare in Brazil. Now, I pass the floor, and I'd like to invite Dr. Mary Ann, CEO of Vital Strategies.
So many people here today. I am my day 2 in Sao Paulo, visiting our Vital Strategies office in Brazil. And I have just been blown away, not only by the strengths of the partnerships, that we have here, but by their impact. And their impact that's driven through innovation, and innovation on so many levels, including how we're collecting public health information. And I'm just really excited for you to hear the results. I won't give any away, but what I will say is that some surprised me. And I realized I had to check myself. I had made certain assumptions, and I probably had some unconscious bias. And the results checked me, and I think that's why it's so important to do this and not to assume that we know what's happening or that we can talk, for the communities that we aim to serve. I wanted to share another reflection. There's a saying, I'm not sure what the origin is, but there's a saying, a rising tide lifts all boats. And it speaks to when you improve a system, you improve it for everybody. Everybody gets better. But that's assuming everybody has a boat. How many people don't have a boat, have a raft, have the floaties, have a canoe with a hole and are working hard to get the water out of the canoe, and what that tells me is that we need to understand that whatever it is we do, even with the best intention, has differential impact on different communities depending on where they're coming from, where they're starting, and what they're experiencing. And that's, again, why it's so important for surveys like this to come to light, to bring to light the specific experiences that are happening. And I think, as importantly, the understandings of the issue. Because unless we integrate those understandings and those experiences and how we think about the solutions, they will never serve adequately the populations that they are meant to serve. And one of the things that we aim to do and strive to do at Vital Strategies is how do we partner with government to build strong, effective, and equitable public health systems, that can protect everyone everywhere. And we can't do that unless we actually understand how these systems are currently affecting people and what they want from them. So I'm so excited about this. People have already heard that, I am wanting to evangelize this work across all of our different partners across the globe. I think that this information is coming at a very critical time where decisions are being made. You mentioned COP30, but also all across the world where a lot of governments are redesigning their health systems and thinking about how they, how they do this work more effectively, more efficiently, and using innovation. So I'm excited for this. I'll stop talking and just thank all of you for coming and thank you for your partnership. In particular, I want to thank you, Mais, and Vive, am I getting it right? And our government partners, and I'm hoping that we can continue to work together and making sure that whatever it is we're doing around public health, we're making sure that we're putting the public and bringing the public, into what we're doing. So thank you.
Muito obrigado, Marianne.
Thank you very much, Marianne. Now I invite everyone here to take their places on the audience. But firstly, would like you all to take a picture. So we have a photographer here that will guide us where we must go to take a picture. Okay, we'll be standing in front of the stage. Thank you very much. Thank you very much. Now, following our schedule, now I invite the Dr. Luciana Vasconcelos and I invite the State Deputy Director of Chronic and Communicable Diseases at Vital Strategy, Dr. Luciana Vasconcelos Sardinha, and Technical Specialist Gabriel Cortes to present the unpublished data from the third module of Mais, Dados, Mais, Saúde. Good evening to everyone. It is with huge pleasure that I'm here with you, delivering this important delivery to Brazil. We are focusing on the population that is so invisible of the Amazonia Legal. This survey was thought within this context of this year of COP30, and we are wanting to shed light in this relationship that is very intrinsic between the public health and the climate changes. So I will now begin presenting a bit of what Pedro has already brought, and I think I can see it from here, that Pedro has already brought the pillars of this innovation program that we can supply information to conduct and induce public policies and effective action. Now, as of now on, as mentioned previously, we already had 3 editions this year. So the first one, we worked about the quality and the access of primary health care. It was a survey that clarified a lot the point of view of the user. We already launched this in April. In May, we also had a survey based and also a questionnaire where we could see the everyday aspect of the discrimination, and we saw that the racial discrimination was the most important one. So on a daily basis, this happens to people, especially with respect to women, black women, and also we observe that there is even more discrimination among these populations, and we could show with information that we also say that black women, they have more difficulty on their day-to-day lives, and we could show this. And now this data, Mais Dados, Mais Saúde, more data, more health, climate, and health in Amazonia Legal. So we must think that climate change, they are not an aspect of future. We're already seeing this. This is happening, and people are being affected. So these transformations depend not only with respect to the feeling of threat, but the behavior to mitigate these problems. To understand these dimensions can indeed bring an alignment that is necessary so that we can act with respect to this. We conducted a survey in Amazonia Legal. It considers the 7 states of the North region plus Mato Grosso and part of the Maranhão, part of the municipalities that are part of the region of Amazonia Legal. And we used a questionnaire that was validated internationally wise, where you could have a scale of climate anxiety, where you could see several point of view with respect to the climate anxiety aspect. And we studied the personal experience of these people that were interviewed with respect to the climate change and what was their engagement. If, in fact, this also causes an anxiety that transforms this in action and in attitude. The collection of data was done 100% online through web, and people, when they looked at the platform, they received a link and an invitation to participate. So it explains the goal of the research, and if the person shows interest, it clicks and receives a link to answer. So there are also this part of privacy. The link could not be passed on to anybody else. So this was very well worked in methodology, so we didn't have a problem of representativeness among other aspects. After this, we received the data bank. It was a sample of around 4,000 interviews. We looked with risk for sex, age, schooling, income, among other aspects, were accordingly. If we didn't, the sample wasn't biased. With a with a methodology used since 2006 by the Ministry of Health, we then the results that I will present here are really represent these 9 states that represent the Amazonia Legal. The profile of the sample, we notice that it is an interesting behavior. Since it is a methodological innovation, we want to show that it really is reaching where it needs. We will see the profile of the sample, which is 50% for each wave of sex, age group. In Amazon, it's younger. Amazon is younger than other regions in Brazil. With respect to income, we have a concentration and lower income. With respect to race and color, there is a discussion. And here we have a partner who has worked with us, which is Janaína Kaluki, which has worked with the survey in all our projects. And she participated in the survey that was launched. And there's a great discussion with respect to this data of Amazonia Legal of being a brown color. Since it's self-referred, these traditional populations, they do not have a very specific identity. So they end up putting in this place, they are put in this place. So these are the questions that I received previously, because why aren't we going to do an assessment? But it is there in the report for those who want to look at it in detail, this aspect with respect to race and color. Over here, we will look based on each state. We observe that it follows the population of the state, the density of each one of these states, and also we asked about traditional peoples, if the person self-identified themselves as quilombola, extractivist, Ribeirinho indigenous, among others. And in summing this all up, we showed it was about 45% of the population. 44.2% named themselves as part of a traditional population. And we observed that in Amazonia Legal, we have an important part of almost 80% and being dependent. Now, with respect to climate anxiety, the first module that I mentioned, which is one of the possibility of seeing climate anxiety according to the experience, the personal experience with these climate changes. A third of the population directly being affected. They report directly being affected by climate change. Around 40% know someone that was in a way or the other impacted by climate change. And 31% notices climate change in a place that is important, be it in where they live or where a family member lives or spent a part of their lives there. So if we look to these three indicators here, and we can observe for the people and traditional communities, the column in blue, we can observe that traditional communities, in all the indicators, they present more prevalence. Now, with respect to climate anxiety, with respect to the engagement point of view, I feel there is a problem. We are living the global warming, a lot of drought or floods or whatever it is. But what is the behavior of such population face of this? We noted that at least half of the population refers that based on what is being presented, they could have behaved in a more sustainable manner. So here we introduce a definition with respect to sustainability, and this shows strongly where half of the population refers to this. Now, 36% state that they've already started the recycling. This also is an alert because it can be reused. Maybe the focal group that we did before implementing the questionnaire, generally speaking, but it can be a double interpretation, recycling and reuse. For example, many of the traditional population, they reuse the materials like a PET bottle. It can be worth gold for other circumstances. So we have these 2 points mentioned. Half of the population then of Amazonia Legal reduced in a way or the other some of the behavior that they judged being harmful in this situation of climate change. 38% feel guilty with respect to the waste of energy, and also we know that in this region of Amazonia Legal there is a more sensitivity with respect to energy, potable water, and safe food. They already notice this aspect of the waste of energy. 46.8% believe that they can do something to solve or mitigate this problem that they are facing. Once again, I draw your attention to the traditional peoples and communities where in all the indicators, the only difference where you switch off the lights, they are more for traditional populations. So it is a population that is already observing this change. This was not something that, like they didn't have this meeting last week. This didn't happen. But they have been observing this in the last decades and noticing that the problems are becoming more and more frequent. They think, oh, I'm behaving differently. I switch off the lights. I tied to reduce my behavior that contribute to climate change. And once again, all the indicators are being higher and prevalence for this population. Now, we also ask that beyond this validated scale about the environment, and this shows that the reality at 64%, it's